Welcome to episode 2 of Security Social Problem, what I'm going to call the social context. So let's first talk about the public health approach to prevention. In cybersecurity, we spend a lot of time trying to assign blame, first on attackers or then application developers, platform or systems engineers or users. But instead of focusing on this model of fault finding and punishment, maybe we could be more effective by following the public health playbook. In public health, no one blames a disease. That disease, we're going to get them. No, it's something that happened, and they focus on getting down to the work of eradicating it. What if we did that instead? First, let's talk about some basic principles of prevention according to public health. According to the CDC, the Center for Disease Control, there are 3 levels of prevention. There's primary prevention, which means that you're intervening before the disease actually occurs. And this consists of specific actions of disease prevention. The target population, of course, is healthy individuals. There's secondary prevention, which focuses on detecting and treating disease at a very early stage. The goal here is to reduce the impact of a disease or injury that has already occurred, but before it's really fully expressed. Then you have tertiary prevention, which is really, it's kind of a misnomer, but you're actually managing disease to slow or stop its progression. It's very similar to incident remediation. The disease has occurred and has had a negative impact on the human, but tertiary prevention seeks to manage the impact of a chronic ongoing disease or injury that might have lasting effects. Okay, so why am I talking about this? Well, security professionals talk about prevention all the time, right? But I don't think it's as well defined and broken down as it is in public health. I find that model that they use to be very, very helpful. And I think we would even be well served if we were to label our controls or our activities using this model of primary, secondary, and tertiary prevention. Let's talk a little bit about how security professionals actually talk about prevention, though. You hear the term, the well-loved term of shift left quite a bit in security when we talk about embedding controls earlier into, say, a software development lifecycle. We focus on DevSecOps or supply chain security, but in my opinion, this tends to be a lot more about tools and tactics and less about changing behaviors and culture. First, I'd just like to say that I don't find the term shift left to be very helpful or very illustrative. It tends to be a technology-centric term, even though DevOps involves people, process, and technology. And not all programming languages, by the way, operate from left to right. There are plenty of, some of them operate right to left. And if the idea is that we're using natural language, well, there are plenty of natural languages that are read right to left or even vertically. I've even found people in tech who program, but they still don't grasp what the shift left analogy means. And they're not being difficult. They literally just don't understand. It doesn't resonate with them, the image. So when it comes to prevention, I prefer a different image. There's one from public health that I think is really powerful. It comes from the River Story, which is credited to a couple of sociologists, Irving, Zola, and Saul Alinsky. It's meant to be an illustration of primary prevention and, by extension, the social determinants of health, which are non-medical factors that influence outcomes over time, like your demographics, your socioeconomic status, things like that. The story goes like this. Someone is standing by the river and sees a person drowning in the current. She saves the person only to find that there are a lot more people drowning in the river, and she has to go rescue them. And now, after becoming physically exhausted after saving so many people, she decides to walk upstream to investigate why so many people are drowning in the river, right? And she discovers that there's a bridge upstream with a hole in it, and people are falling through the hole. Okay, this is similar to cybersecurity. This story illustrates, public health's conflict between responding to emergencies, help people caught in the current and drowning, and the need to prevent health problems from occurring in the first place, stop people from falling into the river. This sounds exactly like cybersecurity, right? So I just like to say that this is the analogy that I tend to use when I talk about a prevention model for information security. I talk about moving upstream. Now, to summarize, I'd just like to see us worry a lot less about internal fault finding within organizations and more about how we can collaborate to build security programs that focus on primary prevention. I think while response is still important, it shouldn't actually be the majority of our work, just like we don't expect tertiary prevention or hospitals to be the primary solution for healthcare, right? You want preventive methods to actually to improve health outcomes. Okay, thank you, and I'll see you at the next episode.